Hello, Dr. Andrea Maxim, naturopathic doctor here in Caledonia and Oakville. And today what I wanted to address is a very common concern that I see with a lot of my new mothers, and that is food allergies, when to reintroduce or introduce the top 8 allergens, and sort of how we can sort of help support the body naturally using different tactics like breastfeeding and the proper nutrition, even as early as infancy. So the biggest question that most mothers have is, when is it okay to start introducing solids? What can I introduce, and what do I have to be looking out for? So the big food allergies or food sensitivities to know of are the allergic 8. So that would be eggs, tree nuts, cow dairy, gluten, which is found in a lot of wheat products, soy, shellfish, peanuts, and fish. And from a naturopathic perspective, I often ask my patients to hold off on introducing these foods until about 2 years of age and try to exclusively breastfeed for a minimum of 6 months. We have to remember that when an infant is born, their immune system is underdeveloped, and it usually won't be strong enough until about 24 months or 2 years of age. Much of the immune system, so let's say 60 to 95%, will actually travel through the digestive tract. So making sure the digestive tract is working properly throughout this period of time is incredibly important to help prevent any childhood illnesses from developing later on in life. So one of the best ways to help support the immune system is a child that is born vaginally and who's breastfed exclusively, so as I said, for a minimum of 6 months. We're finding more of the North American illnesses like digestive upset, food allergies, asthma, eczema that are happening to young children are usually starting in an environment where they've been born C-section and put on formula right away. So having your child be born as naturally as possible and fed as naturally as possible is the number one thing that we should be trying to do at all time. Now, during infancy, and because the child immune system is weaker, anything that the child is exposed to during the first 2 months could mount an immune response. So what we commonly ask our new mothers to do is start with the easier foods, so fruits and vegetables, vegan protein, and of course getting protein from breast milk is going to be the best way of doing that, because these rarely cause any issues that we see commonly in our practice. That's not to say that it couldn't cause an immune response, because everybody is an individual. But when we start introducing the pro-allergic, the allergic 8 foods, they can actually become quite disruptive to the digestive and the immune system, leading to a lot of childhood illnesses down the road. So multiple studies have been shown where breastfeeding is incredibly supportive to both of those aspects of the body, the digestive system and the immune system. And by breastfeeding, we can actually protect our children against chronic ear infections, hospitalizations from severe upper respiratory tract infections, dermatitis, skin disorders like eczema and psoriasis, even SIDS, childhood asthma, even childhood leukemia and type 1 diabetes have all been shown to be less in children that are breastfed more frequently than those that are on formula. And even childhood obesity can actually be protected against with breastfeeding. So most of those conditions just listed, just with breastfeeding alone, are actually very much related to food sensitivities. And from a naturopathic perspective, we always have to remember that the body is working together. It's not just digestion on its own or the immune system on its own. There was one paper in 2005 from JAMA, the Journal of the American Medical Association, that showed children that were exposed to wheat or gluten products before the age of 3 months were actually at risk of developing chronic digestive disorders like celiac disease, which is an autoimmune condition, by about 5 times more than children that were exposed to those foods later on. So when we are introducing foods, the first things we like to see our children being exposed to food-wise would be the easier foods to eat. So as I mentioned, fruits and vegetables. So bananas, applesauce, prunes, squash, avocados, carrots, sweet potatoes, and when we're talking about the grains, brown rice is a nice hypoallergenic grain that we can certainly start introducing our children to. Those are all wonderful for the first 6 to 9 months, and then as they age and as they develop, you can certainly start introducing more of the fibrous fruits and vegetables, more of the vegan type proteins like chickpea, flaxseed, legumes, those are all fine. And then at the age of 1.5 to 2 years, you can certainly start introducing some of the eggs, egg proteins, the dairies, that sort of thing. Now, when you are introducing these new foods from whichever source they're coming from, always be on the lookout for certain signs and symptoms that we're always looking for in our practice. So changes to stool. If they become very constipated or diarrhea, the first thing we commonly look at is what foods they're consuming. If rashes start developing on the skin, if they start getting chronic infections that are difficult to overcome, even runny nose, watery eyes, and mood changes can all be related to food. So the first thing that we can start doing is putting these different food groups on a rotation diet. So consuming one particular food group every 4 to 6 days is a great place to start. And then, of course, if supplementation is required, you can certainly do vitamin D, glutamine powder, probiotics, fish oil, all of which you can find in powder and liquid form, so you can mix that directly into their food, and those all help to support the digestive tract for the infant. If you wanted to do any further testing, we do the food allergy tests in office, so please don't hesitate to book an appointment for that, or find a naturopath in your area that does that. And of course, as always, if you have any other questions or concerns, or any way that I can help you and your family be as healthy as possible, please contact me and visit my blog, which is listed below, and have a happy and healthy day.